So back pain is a very common reason for an individual to visit their primary care provider. A number of patients who have back pain also have symptoms of sciatica, which means pain radiating into the leg. Those patients tend to have a worse prognosis than individuals who have back pain alone. Yet despite the consequences of the presence of sciatica, there are a number of very important gaps in our understanding of what to advise primary care providers to do for this patient population. Specifically, the question of whether or not referral to physical therapy at this early stage of care benefits patients was an open question when we designed this study. So we recruited patients who had just had that initial primary care visit for back pain with sciatica. We asked them to either take a usual care approach, which was to just wait and see. Many patients recover fairly quickly without a lot of assistance, or we referred them to physical therapy for 4 weeks. And what we found was that the physical therapy option helped patients speed their recovery, reduce their disability to a greater extent over the 1-year follow-up period that we included in our project. No, I wasn't surprised by the results because the importance of keeping patients active, keeping them at work, helping them to remain physically active is something that we know helps across a broad range of musculoskeletal conditions such as back pain. It hadn't been demonstrated sufficiently for this particular patient population, but what we found is very consistent with a lot of other recommendations for patients with various musculoskeletal pain conditions, that activity, exercise can be beneficial and that physical therapists can help to provide that care. This is a really common population of patients, and what to advise early on to patients with back pain and sciatica is something where there's some confusion because there's been a lack of research studies that's examined this particular type of back pain. And we think it's important that primary care providers and that patients understand that physical therapy can help them accelerate their recovery, assist them in regaining their activity levels, and overall help to provide assistance in regaining their quality of life when it's provided early on in an episode of care.